equity is quite a refined term. We might know what it means. We might have a definition. However, what we should do is think about what it means for citizens, for New Zealanders. And one concept that people get, and it's something that's quite inherent in our sort of national identity, is this concept of fairness. And equity, in a sense, is just a flash word for fairness. So if you talk to people about if someone accesses a healthcare service like a cancer treatment, and one person gets a different outcome from that treatment than another, that's not fair. People get that. If we try to couch it in terms like equity and so on, then it may not resonate quite so much. I think the example of immunisation in this country is a really good one. So having trained in public health, through the late 90s and the first part of the 2000s, we had not very good immunisation rates in this country, and particularly poor rates for Māori and Pacific children. For Māori and Pacific, they were down in the 70s. And there was a very strong drive, a whole range of initiatives put in place to improve immunisation across the board for all children. Now, most immunisations for most children, whether they're Māori or Pacific or non-Māori, non-Pacific, will be delivered in general practice by a nurse. So you might be able to get the first 80% of kids reasonably easily through that standard general practice visit. But then to get the next 10%, there's a bit more effort required. So that might require active recall, phoning the families, and ensuring that they come in, being opportunistic when they come in for other visits. For example, an adult comes in for a consultation, asking about the children's vaccination status and actively immunising them then. And then for that final 5%, it might require even more effort and therefore more resources. You might need to have dedicated teams who are going out and finding these children, going into their homes and vaccinating them. So that's a really good example in my mind of applying an equity approach, or in more technical language you might call it proportionate universalism. So the two are not mutually exclusive. We have a universal health service. It's entitlement for all New Zealanders, but the degree of resource that we need to apply to ensure it's fair can and should differ, and that should be the experience of people. They should expect the system to deliver for them regardless of what their level of need is. If we improve our services, access to them and experience of services for the people who perhaps are the most disadvantaged, everybody gets a benefit from that, not just because when they need to access services they are high quality and accessible, but actually we all benefit from having a healthier population. Is us thinking more broadly about health, not just as an outcome, but health as an enabler of well-being, and well-being being about people being able to sort of pursue their dreams and aspirations with their lives. And health is just a key enabler of that. So I think everybody has the right to good health so that they can live their fulfilling life that they want to and achieve well-being. Well, I think this is a great bit of work that's been led out of the ministry and working closely with others in the sector, with people with expertise, and also canvassing different views from different people to ensure that it does resonate, that people can understand it and get value from it. And I think it's a really good example of the ministry's leadership in action, where we don't have all the expertise, but we've got this role around convening. And it's been great to hear the feedback on that definition. That's been very positive, not just about the definition, but about the fact that the ministry's led a process and come up with a definition that's really useful and I think will help guide the wider sector. So I just encourage staff to think all the time about how do we ensure what we are doing in our work is fair, and in particular our starting point for the work should be, what does it mean for access to, for experience of, and for outcomes from care for the groups that are the most disadvantaged. If that's the starting point, then you'll take an equity approach in all your work. I'm really pleased to see us putting that publication out. It canvasses the views that we've gone out and actively sought. It's analysed them, and it just lays out the thoughts and ideas and the aspirations, I guess, that people have in the sector for us to be able to achieve equity.